Welcome to the May 2025 SHARP information session. During this program, we invite speakers and health professionals to offer information sessions about resources, services, and tools available to help English-speaking seniors to age in their communities. And my name is Erica Botner. I'm a program manager for seniors and the SHARP program at CHSSN. I'll be your facilitator for today's session. And today we have a wonderful guest speaker, Shamese Barakat. She's an occupational therapist and co-owner from Kinatex Sports Physio. So Shamese graduated from McGill University in 2006. She has practiced in the private sector ever since and joined the largest rehabilitation banner in Quebec, Kinatex Sports Physio, in 2017. She became co-owner of Kinatex Sports Physio Pierrefonds in 2019. She works in musculoskeletal physical rehabilitation with the CNESST and SAAQ clients, post-work and car accidents. She also performs driving evaluations, both in the clinic, both the in-clinic assessments and on-road tests in the West Island of Montreal. So she is the perfect person to have with us today. She'll be sharing information about safe driving assessments, driving accommodations, and knowing when it's time to stop. It's a touchy subject for a lot of people, but a very important one for our safety as well, and also for maintaining our independence for as long as possible.
So first of all, thank you for having me here today. Thank you for the introduction. I'm happy to be here with you, and I'm hoping that you will find this presentation helpful. I will list my contact information at the end of these presentations, so feel free to reach out to me by phone, by email, if ever you have any questions. I will try to get to you in a timely fashion. Driving is a privilege, not a right. But what exactly does that mean? So in many places, including Canada, driving is considered a privilege, not a right. It means that while individuals can obtain a driver's license, the right to drive can be revoked or suspended for various reasons. Okay, so unlike fundamental rights, which are inherent and guaranteed, driving privileges are subject to conditions and can be lost if those conditions are not met. So as we know, driving involves significant responsibility for the safety of oneself as a driver and other road users, so pedestrians and other drivers on the road. And so the government can take action to protect the public safety if drivers violate the rules or demonstrate unsafe behavior. So the SAC is aiming to ensure that drivers, especially seniors, but all drivers across the board, maintain the physical and mental capacities to drive. So that is the main reason why the SAQ will send a letter to your home asking you to undergo an evaluation with an occupational therapist. I pulled out some stats from the SAQ website, things that I thought were pertinent to this presentation and very interesting. In Quebec, seniors are involved in car accidents at a rate higher than their share of the driving population. From 2016 to 2020, an average of 88 senior drivers were involved in fatal accidents each year, consisting of 16% of all drivers involved in fatal accidents. 207 drivers aged 65 or older were involved in accidents resulting in serious injuries. So once again, representing a whopping 12% of all drivers involved in this type of accident. And over 4,000 drivers aged 65 or older were involved in accidents resulting in minor injuries. So what are the contributing factors here? Why do seniors have a tendency to get into these fender benders or these serious types of accidents? Well, there's multiple factors. There's factors that could be a combination of several things as well. So first of all, cognitive decline. So as we know, when people age, cognitive abilities can decline, potentially affecting driving skills. There could be physical decline. So seniors may experience decreased reaction time, vision, hearing problems, decreased muscle strength, impacting their ability to safely maneuver vehicles. It could be medications as well. So as we know, certain medications can impair driving ability. Some medications can cause dizziness. It can cause, sleepiness, drowsiness. Some medications may also interact with one another. Okay, so that's something that could impact your safety on the road. and as well reduced driving experience. So some seniors may reduce their driving in general due to, the physical and the cognitive limitations, but that potentially leads to less practice and increased risk of accidents on the road. Okay, so it's multifactorial. So this is a question that I often get a lot from clients that call the clinic. When will the SAQ require you to undergo a driving evaluation? And it really depends on three things. I will elaborate on this. It depends on your age. It depends on the class of your driver's license. So as you know, in Quebec, we do have 12 different classes of driver's license, and it depends on your state of health. So let's talk about your age. At the age of 75, drivers must complete a self-declaration of medical information form. This is a form that the SAQ will send 6 months before your 75th birthday, and they will send this to your home address. It's something that you must complete and send back to the SAQ. At that point on, at age 80 and every 2 years after, drivers must then undergo a medical examination and, for the most part, an eye test. So at age 80 and every 2 years later, you will be getting 2 forms at home. The first form is called the M28, specifically the report on a person's state of health that a physician must fill out. And you may also receive the M5, which is the eye examination report by an ophthalmologist or an optometrist that must be completed. Okay, so that could trigger the process of getting evaluated by an occupational therapist. Now, the class of the driver's license will trigger a different procedure depending on what class you hold. So for example, if you hold a class 1, 2, or 3 license, allowing you to drive a road tractor, a bus, or a straight body truck, or if you hold a class 4A or 4B, allowing you to drive an emergency vehicle or a minibus, the SAC will require you to provide them with a medical report, the same medical report on the state of your health at ages 45, 55, 60, 65, and then every 2 years thereafter. So it's a little bit of a different process depending on your driver's license, but the procedures are standardized across the board. So most of us have a class 5 driver's license, so we drive a passenger vehicle. We will get the forms sent to us at age 75 for the most part, unless your state of the health requires you to submit forms prior to that age. So you must notify the SAQ of any change in your state of health that could hinder your ability to drive within 30 days of that change. Okay. Failing to notify the SAQ about a change in your health that may affect your ability to drive can lead to several consequences, including the suspension of your driver's license, a refusal to issue a new license, or the addition of conditions to your existing license. The SAC may also impose fines and impound your vehicles. Now, there are 3 ways for you to report your illness, and I'm going to go through what types of illnesses must be reported in the next slide. But if you need to report your illness, you can do so by visiting a SAC service center in person. You can call their toll-free number, which I've listed here, or you could submit a report online via secure email. So if we have 30 days to notify the SAC of an illness, what types of illnesses require this notification? So this is from their website. I pulled it out and I pasted it here. If you have any questions, they do say that you can call them at this number toll-free to discuss your health condition. But mainly if you have any eye diseases or disorders such as cataracts, glaucoma, retinopathy, that needs to be notified. So you need to divulge that to the SAQ. If you have bilateral hearing loss with or without a hearing aid as well. If you suffer from severe vertigo. If you have a heart condition. If you experience excessive sleepiness related to a sleep disorder, you have to notify the SAC. If you have had a significantly limited mobility for several months in your neck, your hands, and your feet. If you have a serious behavioral problem or psychiatric disorder. If you have a substance abuse disorder as well. If you have a cognitive impairment, such as dementia or Alzheimer's disease, that needs to be divulged to the SAC. Epileptic seizures as well. If you have sustained a neurological condition, so if you have had a stroke, if you have had a new diagnosis of Parkinson's, you need to notify the SAQ. If you have experienced a loss of consciousness, syncopes, or non-epileptic, convulsions in the past 12 months, that needs to be divulged. If you have insulin-treated diabetes, lung disease, and so on and so forth. So this is a comprehensive list that allows you to determine whether or not you need to divulge your illness to the SAQ. Okay? Now, once you receive a letter at home stating that you have to undergo an evaluation with an occupational therapist, what does that entail? That is the next big question that I do get from a lot of my clients. So the OT evaluation consists of two parts. There's the in-clinic segment, and then there's the on-road test. For the in-clinic evaluation, which usually lasts anywhere from 2 to 3 hours or more, depending on where you do your assessment, we do look at several factors, several spheres. We look at your physical mobility, your strength, proprioception, your coordination, all things that you need to be able to drive a vehicle safely. We will do a vision screening if you haven't been seen by an optometrist or an ophthalmologist. So we will look at your visual acuity, your visual pursuits, your saccades, amongst other things. And we do cognitive testing with a lot of standardized tests. So some OTs will do paper and pencil tests, there's computerized tests, but we will look at different spheres of your cognition, such as your divided attention, your mental flexibility, your executive functions, okay? This is going to give us a portrait of how things are going to look like on the road and how we want to test you on the road. So it gives me a snippet of what the difficulties may be on the road. In addition to all of these tests, we also look into your driving habits. So we'll take a look at your driving habits, your history. Have you been involved in car accidents? Do you have difficulties with certain maneuvers, certain environments? We'll also take a look at the knowledge of your road signs to see if there's anything that you might need to review before you go on the road with us. And we'll also take a look at your verbal reasoning and judgment via driving scenarios. So it's a pretty lengthy assessment period, but it really gives us a lot of feedback on how you will potentially be on the road. Now, the road test. I do my road tests with a driving school. Most occupational therapists do. So we do not take the vehicle of the client. We will take the driving school's vehicle that's equipped with a dual brake system, which makes it safe for everyone involved. Our test is standardized. So what does that mean? That means that the road test is going to be the same exact test for all of our clients across the board. And it tests for different things. So we want to look at lane changes in different environments. We want to take a look at, your turning right, left, especially the unprotected left turns. We want to take a look at how you're doing your verifications. Are you verifying your blind spots? Are you doing them properly and consistently? We're going to do search tasks to assess for visual scanning. A part of the test we call it the non-directed portion. And this part of the test is used to assess your executive function skills. So what does that mean? It means your organization, your planning, your anticipation. And then we'll have multiple, busy intersections that we want to make sure you're able to manage. We do have a highway portion as well, so merging and exiting the highways. It's usually a 1 hour long test. Once that is done, once the occupational therapist completes the in-clinic portion and the road test, that's where we can then formulate a recommendation. So OTs only have a power of recommendation. We have to fill out a report. It's called the M57. It's called the Functional Assessment Report on Physical and Mental Fitness to Drive. And this will detail all the results that we've gathered from the in-clinic assessment and the observations that we gathered on the road test. And in the end, we'll produce a recommendation that we then send to the SAQ. The SAQ will have the final say with regards to your driver's license. Okay, so that's something that I always reiterate to my clients. The OTs only have a power of recommendation. Now, this is the interesting part for everybody. It's what can you do to maintain your driving privilege? Okay, so we'll talk about certain strategies, certain things that you can do just to make sure that you keep being safe on the road, things that you can discuss with your loved ones as well, with friends, with any senior in your environment to make sure that they're being as safe as they can. So first recommendation is to aim for yearly eye exams. So seniors should generally aim for yearly eye exams. The American Optometric Association recommends annual eye exams for anyone aged over 60 and over. These exams are crucial for early detection of age-related eye conditions like age-related macular degeneration or glaucoma, which can significantly impact your vision. I haven't listed it here, but hearing tests as well would be a good idea. If you've noticed or if someone has mentioned that your hearing might be slightly impaired, it is a good idea to also go and get hearing tests. Earlier, we discussed the impacts of medication and medication interaction. If you notice that after taking your medication, it causes dizziness, drowsiness, maybe confusion, lethargy, it would be a good idea to discuss this with your family doctor, okay? Especially if you tend to take the medications at the start of your day and the secondary effects manifest a few hours later when you tend to be on the road. Really important to get that sorted with your physician. Another recommendation, which I highly recommend that anyone over 50, over 60, just in general, a good thing to do is to review driving guidelines. So what you can do, I posted the link here, is you can go onto the SAC website. They have a version in English and in French. And they also have a free driver's handbook, which I'll show you in the next slide. So they have questionnaires, and it's about 20 to 30 questions. And it reviews a lot of the technical guidelines, but also a lot of the practical things that might occur on a day-to-day basis. I highly recommend, every once in a while, go into the SAC website. It's a free questionnaire, do the questions. The questions will change every now and then, but they're very interesting and it's good practice. So I pulled out one of the questions from the SAC website. This is what it looks like on the questionnaire. So for example, here it says, indicate all possible consequences of a worn tire. Number 1, flat tire. 2, loss of control. 3, good traction on the road. 4, overheating. 5, a blowout. 6, no consequences. It looks like I got the right answer here. So 1, 2, 4, and 5 are the correct answers. This is a bit more technical, but you'll see in the next slide, they do have more practical questions, which I think is very pertinent. So I'm going to let you guys answer this question for me. In this situation, is this lane change legal? So here you see a yellow car on the right-hand lane wanting to switch lanes to the middle. But in your opinion, is this change legal? Yes, because there is no passing sign. B, yes, because the lane is free. Or C, no. Okay, so if you have answered C, that is the correct answer. You cannot make a lane change on a solid line. Okay, so that's something that I tend to see on the road tests. Clients will make lane changes on solid lines. Another thing I'll mention now, since we're here, you have the visual in front of you. You also want to try not to make a lane change in the intersection. You want to make sure that you've passed the intersection to make a lane change on a dotted line. So that's more of a technical question. So very interesting, highly recommend that you go into the SAQ website, you do a couple of these questions. Like I mentioned, they have a version in English and in French. Another resource that I highly recommend is the SAQ Driver's Handbook. So you can download the PDF version online, or you can access it via this link that I pasted. It is quite lengthy. I don't suggest that you go through every page, but I do think that, for example, Chapter 3 on the road signs and traffic signals could be a good review. The reason why I say this is because sometimes when I'll do the in-clinic testing with some seniors and I'll show them some road signs, there tends to be some difficulty with recognizing the road signs, but also interpreting the road signs and understanding what they mean. So this could be a really good review as well. It's a free handbook. You can find it online in English and in French. Speaking of road signs, we're going to do a little pop quiz. Okay. What would you do if you saw this road sign? It's a yield. Exactly. Perfect. Great. So yes, it's a yield the right of way to vehicles traveling on the road that you are about to enter. So you do not have the right of way, you have to yield. Okay, what about this? What does this road sign mean? A red circle with a red diagonal bar through it indicates that anything within the circle is prohibited. So yes, therefore, this sign means you're entering a zone where passing is prohibited, a no passing zone. What does this mean? We don't see this often in Montreal, but I have seen it in the past. What do you think this means? So this sign warns you of a winding road with several successive curves up ahead. You want to make sure you slow down and you want to make sure that you're more cautious. Great. We have a last one. This we see pretty often in Montreal. What would this mean? This is a reserved lane for buses. It's a reserved lane between these hours. So for example, on a Sunday, you would be able to drive on the lane. However, on the Monday morning at 6 in the morning, it's reserved for buses. You would not be able to drive on the lane. So we call it a reserved lane sign. Okay, great. So let's continue. Okay, so continuing on, what can you do to maintain your driving privilege? This next recommendation, I think, if I had to choose one more practical, something that really will have an impact on your driving skills, it would be to take a refresher course with a driving school of your choice. Specifically, I know that CAA across Montreal offers personalized driving courses, but I think that if you reach out to a driving school in your area and you ask them, I would like to take a one or maybe two classes. They're usually hour-long classes, just to see if you have any feedback regarding my driving. They're going to review blind spot verification. They're going to review, making sure that you're merging onto the highway safely, that you're exiting safely. I highly recommend refresher courses, especially if you find that your confidence on the road is not what it used to be. If you find that you're getting honked at often, you're feeling that maybe you need a little bit of help. It's something that definitely is proactive that I highly recommend. I wanted to highlight some mistakes that I do see on my road test, things that I will then tell clients to go work on with a driving school. So one of the main mistakes that I will see is the blind spot verification. So some clients won't know what a blind spot is. Some clients won't know how to verify a blind spot. So just to explain, a blind spot is what you cannot see between your rear view and your lateral mirror. A blind spot is something that you actually have to verify by rotating your neck. So if you have limited neck rotation, what you can do is just slightly compensate with your dorsal rotation, because you have to be able to quickly see what's behind you in the passenger window. That's where your blind spot is. So whenever you have to turn left or right, whenever you have to make a lane change to the left or right, that's how we tend to explain to our clients what a blind spot is. So that's one of the main issues I'll see on the road. It's either that the blind spots are not verified at all, or they're not consistently verified, or they're not verified in a proper fashion. That's one thing. Another common mistake I'll see on the road is when clients will not keep their lanes when turning. So let's say you have 3 lanes, you're in the left lane and you want to turn left. Sometimes I'll see clients making a very wide angle turn and they'll turn onto the middle or right lane. So that could be potentially dangerous. What we want to make sure of is you want to make sure that you turn onto the lane that you're in and then make a lane change once it's available. Okay, so those are things that you can address with a driving school. They can help you kind of refine your skills, make sure that you're verifying your blind spots properly. Vehicle modification. So this is something that can help if you're limited more in terms of strength and mobility. Highly recommend consulting with an occupational therapist for this. But there are different types of modifications that you can do in order to make sure that your driving is as comfortable and as safe as possible, of course. So you can have larger or convex mirrors installed for your rear view and your side view mirrors. So this helps improves visibility, and it helps reduce the blind spot, especially if you have that limitation for rotation. Here you'll see a swivel seat. So for this, unfortunately, most OTs in the private sector won't be able to help you with these more larger modifications. I usually will refer my clients to the rehab centers, such as Constance Lethbridge in Montreal. But swivel seats do exist to facilitate entry and exit of a vehicle for someone that has mobility issues. Here on top, you'll see you'll have seatbelt adjustment modifications. So you can have seatbelt extenders, which greatly improve the ergonomics of your seatbelt. It helps you clip and release your buckle with ease. There's a lot of different types of modifications out there, but consulting an occupational therapist would be the way to go about this. You can also have hand controls installed to operate accelerators and brakes. Okay, what else can you do to maintain your driving privilege? It's to adopt safer driving strategies in general. Okay, so these are common sense, but things that maybe could be, just good for you to remember. You want to make sure that you take a break every 2 hours to counter the effects of driver fatigue. Okay, especially for long distances. We greatly recommend this. You want to make sure that you plan your routes before carefully leaving the house. So you can use apps like Google Maps. There's an app that you can download on your phone. It's called Waze. I use it all the time. It'll show you different ways of going or getting to from point A to point B. You want to make sure you choose familiar routes. You want to make sure that you try to avoid dense or high-speed traffics if that's something that you don't feel comfortable driving in. So you want to plan your route before you leave your home. You want to make sure you drive during the daytime whenever possible to maximize visibility. You want to also, when driving, maintain a safe following distance at all times. So you want to leave a car length space between you and the car ahead of at least 3 seconds. So it's called the 3-second rule. You might have heard of it. It means that you should leave enough space between your vehicle and the one ahead so that it takes at least 3 seconds for you to reach the same point that the vehicle that you just passed. And this just provides time for you to react to potential hazards on the road. Okay. When in doubt, don't go out. So we want to postpone or reschedule any plans or activities or outings if the weather is bad. Common sense once again. And you want to limit distractions inside the vehicle. So for example, if you're going to an unfamiliar location for the first time, you have your GPS, you have your friend in the car that's telling you about his day. You want to make sure that you try to limit as much as possible. So maybe ask the friend to stay quiet for a little bit as you focus on your GPS, you focus on your driving situation, the driving environment. You want to limit as much distractions happening in the car as much as possible. You also want to try to adopt strategies specific to nighttime driving. Okay. Why? Because driving at night, at dusk, or at dawn can be more challenging for seniors, especially those with vision issues. At night, our vision is affected by the decrease in natural light. Headlights are unable to compensate for the lack of daylight, and contrasts are less pronounced, which affects depth perception and our ability to see movement. Hence why at night it's a little bit harder to judge distances. You want to make sure that you increase the safety margin between you and the vehicle ahead a little bit more than you would normally during the daytime. You want to slow down also, so drive at slower speeds because darkness does reduce a driver's field of vision. You want to make sure that you keep the windshield clean and in good condition at all times because a broken, a dirty, or a cracked windshield will reduce your visibility. And it could cause, visual fatigue as well. So we want to make sure that the windshield is clean at all times. With the exception of dashboard lighting, all other lights inside the vehicle must be kept off to reduce the risk of glare. So especially if you have visual disease, a vision problem. You want to also avoid passing other cars in front of you when in doubt, as at nighttime, oncoming vehicles do appear further away than they are. So yes, it's good to review your knowledge, review road signs. It's good to take these questionnaires on the SAC website, for example. It's really good to refine your driving habits by going to a driving school and taking some refresher classes. But it's also really pertinent to adopt safer strategies when you're driving on the road on a daily basis, during the day and at night. Okay, so when is it time to stop? This is a very tricky question. It's very difficult for families to discuss with, their elderly parents, with their relatives. This is a really, really great resource that I found, and I direct a lot of my clients and their families towards this resource. You will have here the link to the PDF that you can download. Very, very interesting, but it kind of helps open the conversation with a loved one in terms of how to broach the subject, what to say, and also how to determine if this conversation has to be had. Okay. So in this book, they say that when faced with a discussion about driving abilities, with whom do older adults prefer to talk? They say that marital status is a significant factor that determines who should have the conversation with the older driver. The top choice of married drivers, so they did make a poll, 50% of older drivers did say that they want to hear about driving concerns first from their spouses, the person that they trust the most. Okay. Other drivers that live alone prefer to have these conversations with their doctors, their adult children, or a close friend. Now, I usually get this question from family members of clients, even family members in my family. They want to know, what are the telltale signs? What are the red flags that you have to look out for when you have a feeling maybe that someone in your family might need to relinquish their license? Okay. This is found in that resource that I just mentioned. So I basically just pasted the list onto here. So these are driving behavior warning signs. So you want to take note of what you notice and also how often have you noticed this when you're in the car with your loved one. I don't know if you can see properly, but I will list them. A difficulty turning to see when backing up. So that's more of a physical limitation. A difficulty in, for example, signaling, parking, hitting curbs. So that's a telltale sign is when your loved one starts hitting the mailbox, hitting the side of the garage. There's a lot of dents on the car. That's where you have to maybe start asking some questions. When you have a failure to notice important activity on the side of the road because you tend to operate in a tunnel vision where they're focused so much on what's happening in front that they tend to sort of disregard a little bit more the peripheral vision, what's happening to the side of the road. You have trouble navigating turns. Your loved one is driving at inappropriate speeds, so either too slow, for example, when merging on a highway, which could be problematic, or too fast in a school zone. Have maybe bad judgment as well on making left or right turns, not noticing some road signs, not interpreting them properly, near collisions, near misses, moving onto the wrong lane or driving in opposite lane. So these are telltale signs that if you notice them and you've noticed them often, should ring a bell, should ring a bell in terms of, okay, should I have this discussion with my father? Should I have this discussion with my friend? Should I myself, as a senior, maybe address the situation, be proactive, take a refresher class, and see what the driving instructor tells me? Okay, these are just the warning signs. Now, very difficult to open this topic of conversation. I do realize that it is a loss of autonomy for a senior, but it's important to maintain driving safety on the road. So in this resource that I shared in the PDF, you will find a couple of tips and tricks on how to open the conversation. So they say that early, occasional, and candid conversations establish a pattern of open dialogue and can reinforce driving safety issues without the strain of asking someone to change his or her driving behaviors immediately. So you want to try to open up the conversation to get a feel of how the driver reacts, and then to discuss, build on that conversation. We don't want the driver to feel attacked. So there's a couple of conversation openers that they had listed that I think is interesting. There's the health and safety first. So when driving is placed within a larger context of other safety concerns, it may take the personal edge off of the conversation. You can also discuss, that driving isn't what it used to be back in the day. So family members of any age can find common ground by talking about road conditions nowadays, such as the faster, the heavier traffic that make driving maybe a little bit more stressful than back in the day. You can also open the conversation by talking about a news report. So did you hear about the car accident in the news today? So you can use news reports to inform, not scare older adults. News about accidents that involve older and younger drivers can improve or provide an opportunity for you to discuss, um, you know, the situation with a family member or a loved one. And it could also be, as mentioned here, how did granddad stop driving? So this opener may provide an opportunity to reveal personal feelings about driving and family intervention. You want to make sure that you're approaching it in a way that could be constructive for you and for the person involved. So once you've had that discussion with your loved one, or once you've had the reflection for your own self, for your driving capacities, if you decide, or if your loved one does decide to relinquish their driver's license, I just wanted to quickly go over the procedures. They're not complicated. There's different ways of going about this. You can cancel your driver's license yourself online. So you have the link here. This is what it looks like. It's a very straightforward procedure. You can also do this by the mail. So all you have to do is fill out the driver's license cancellation form. I've added the link here as well. Fill it out, send it by mail. Or what you can do is when you get your driver's license payment notice. So this notice, as you know, is sent to each of us by mail every year before our birthdays. There's a portion, there's a little segment there where you can actually fill it out and say that you want to relinquish your driver's license. You're not interested in renewing your driver's license. Or you can send the documents once again by mail to the following address that I've included here. You can go in person to a service outlet. So you can do that in person. Some people feel more comfortable doing that in person, or it could be on the phone at this number that I've listed here, and the cancellation will take effect on the day of your request. So that is it for today's presentation. I've listed my contact information here. You have my email address. You have my phone number as well. If you have any questions, if one day you have to have this conversation with a friend, with a family member, if you do get, a letter from the SAQ and you want to ask specific questions about the process, if it's confusing, you can reach out to me at any time.
And I just want to say a huge thank you to Shamese for your time and for the information, the really useful information that you shared. It's a topic that we don't love to talk about, but it is really, really important for sure. And I think that the tips that you gave to help people to keep their privilege for driving are really, really valuable. So thank you.
My pleasure, anytime. I hope it was useful, and I hope that you can take little bits, of the presentation and try to apply it. Maybe try having the discussion with a family member or a loved one. The goal is for everyone to be safe on the road.